Yeah, so we utilize many forms of technology in our office to try to improve our patient outcomes. One very important piece of technology is a CBCT, which is produces a three-dimensional scan of the jawbones and the head. This allows us to safely plan dental implants. We used to only have two-dimensional radiographs, and there's a lot of anatomy that you miss out on when you're trying to plan a surgical case when you can't see the whole picture. So that's been extremely helpful in implant dentistry and in our practice. We also take digital impressions of people's teeth. The traditional way of taking impressions is with a tray full of goop, and it can be uncomfortable for the patient. And then that's transferred to a stone model that can break, and it's hard to keep that long term. With the digital impressions, we can keep those files digitally, we can manipulate them on a computer, and we can also merge them with the three-dimensional x-rays that we take, which allow us to plan implants not only based on what we see on the x-rays, but what we see by looking at a patient's mouth clinically. So when we use our three-dimensional imaging, we can combine that with a guided implant technology. So we plan the implant as safely as possible, and then our guided technology allows us to make sure that we're placing that implant in a safe manner as well, and getting the implant right where we want it so that the dentist can put the crown on and it can be aesthetic and functional. So the long-term outcomes we're looking for are, when it comes to dental implants, we want the dental implant to ideally last forever, if possible. We try to avoid complications. Implants can have complications, just like teeth can. But if we do everything just right, we significantly minimize the risk of ever having problems with that implant. So if we're able to place it right where we want it, and we know that we get it where we want it using our technology, then we have a much better chance of providing that long-term outcome that we're after. It's very common for patients to be fearful of the dentist, and in particular, some of the procedures we do are surgical in nature, so it can cause a little bit of an increased level of anxiety. So in order to try to help alleviate that, to make patients comfortable in our practice, we do offer some sedation options. We can provide nitrous oxide sedation, which is commonly known as laughing gas, that you may have received in a dental office before. Sometimes that alone is enough to help a patient relax a little bit and get through the procedure. If they have a higher level of anxiety, we can offer oral sedatives, which is just a prescription that we prescribe in advance, and the patient brings it with them to the appointment. They take the medication, and that can help relax them significantly during the appointment. And then another level of sedation is IV conscious sedation, where we have nurse practitioners come into our office and provide medications via an IV, which typically help relax the patients even more than some of the oral medications. So that can help significantly. But I also find that just educating the patient and kind of walking them through the process and assuring them that this is something that we do every day and we're very experienced in it, and while it may sound scary, the patients are comfortable during the procedure because they're anesthetized like you would be for any other dental procedure, and many of our patients can do very well without any type of sedation, but we certainly offer that for anyone who feels they might need it.